let's get started.
Stop that at once!
It's a communal garden, Miss Cummings. I'm well within my rights.
Put that down!
You knew this was coming. Are you all packed?
What are you talking about?
Look, we both know what's happening today. Let's not play games. You got my letter. The eviction notice, which I sent 3 weeks ago.
Eviction? What a load of nonsense.
I am sorry, but I've given you enough warnings. You've left me with no other choice.
You're being utterly absurd.
Unbelievable. It's worse than ever in there. This was a decent flat until you moved in.
I'll ask you to show more respect when referring to my belongings.
You've got until 4. Then you have to go.
You're delusional.
Did anyone see the news last night? They're still banging on about it.
I try not to buy into the media's feeding frenzy.
It's weird though, they keep talking about an unnamed female detective, and yet we all know it's Eva.
Is there really any need to keep going over this?
All right, sorry for caring. It's not every day that someone you know gets shot dead.
Jimmy.
Hi, mate.
I didn't know you were coming in today.
Couldn't be at home.
Well, it's understandable.
Right. Well, whatever you feel like doing, that's absolutely fine. Only, I haven't got any patient schedule for you today.
Well, I could do any last-minute walk-ins.
Got to get to the campus surgery. I'll see you later.
Hey, look, if there's anything you need, mate. All right.
Thanks.
Jimmy, shouldn't you be at home?
I'm fine, honestly.
Good to see you, old boy.
Surely you can't be seeing patients today.
I need a routine. Being at work helps keep my mind occupied.
Absolutely. Best place for you.
Yeah, maybe you're right. Familiar faces, familiar environment. It won't help me when my dad died.
Best way to tackle grief, embrace it head on. Very proactive.
You're off on home visits?
Yeah, Julie's got me checking up on some of Nick's old patients that she's worried about. I figured if I could paint on a smile, then maybe I could face the world.
Hello, you.
Easy, Tiger.
I can't help it if you're looking simply irresistible.
Yeah, I'm not exactly in the mood.
Well, sorry. I just want to show you that I'm here for you. You know, I'm not going to make that same mistake twice. And this is me trying, by the way.
Yeah, I know. Keep it up.
Miss Cummings, I'm Dr. Bell from the Mill Health Centre.
And?
Well, you've missed your last couple of appointments with Dr. West, so we're a little bit worried about you.
So why isn't he here?
I'm sorry to have to tell you that he was killed in a road accident.
I see, so I'm left with you, am I? Well, I knew they'd send someone eventually. At least you saved me a trip to the surgery.
Well, actually, home visits aren't for your general convenience. They're for patients who genuinely...
Can we hurry this up? I need to get on.
I understand that you were diagnosed with chronic obstructive pulmonary disease 6 years ago.
Well done for stating the obvious.
Has your cough been any worse lately? Okay, well, let's examine you, shall we? Just have a listen to your chest. Okay. Okay, and again. Deep breaths. Yeah, it does sound like you've got an infection. Acute bronchitis, maybe.
Really?
You need to manage your COPD very carefully because you're very susceptible to infections like this. And if you don't mind me saying, all of this dust gathering everywhere, it's not helping your breathing.
How dare you?
I'm sorry.
Looking down your nose at my belongings.
I wasn't.
You think I'm a hoarder, don't you? Well, just for the record, I'm not.
Okay, right, well, I'm glad we've got that sorted out. Now, you need to make sure that you don't run out of medication for your nebulizer.
I know the stereotype. Sad loners who hoard random things because they've got nothing better to do. Well, the difference is I'm a collector.
Right.
Everything here has a reason and purpose.
I'm sure it has.
Remnants of dreams and memories wrapped up in the past.
So I need to write you a prescription.
What day is it today?
Thursday.
The date, you stupid girl, the date!
It's the 23rd, I think. Look, I can see that you've got a lot on your mind right now, but I need to know that you are going to take these antibiotics. Miss Cummings, have you lost something?
I have to get a paper with today's date on it. It's important. I need it for my collection.
All right, well, there's plenty of time before the shop shut.
It's you being here that's made me forget. Just go, will you?
OK, but I need to know that you were going to take these antibiotics, because this infection needs treating properly.
Get out!
I will see myself out.
It's hardly convenient, Dr. Granger. Oh. All right, I'll see what I can do. Goodbye.
Problem?
Well, it seems all the PCT have to do is click their fingers and Dr. Granger goes running.
Well, he's got to keep his nose clean, isn't he?
I suppose.
If you need someone to cover the campus surgery, I can do it.
Oh no, it's fine, really.
Yeah, well, it makes sense. I'm the one without a patient roster this afternoon.
Well, if it's not too much for you.
To be honest, it'd get me away from all the scrutiny. There's only so many pitying looks a man can take.
I was just about to make a coffee. I'm not sure if you wanted one.
No, I'm fine, thanks.
Well, just let me know if you change your mind.
Point taken.
Have you opened the letter?
You!
Oh, come on, Miss Cummings. I think you owe me more than that. I've been pretty patient with you over the last 7 years.
Not surprised the amount of rent you've had out of me.
This isn't about money, and you know it.
No, it's about you being a power-crazed tyrant. Well, you're not going to intimidate me. I'm not going anywhere. This is my home.
Your rented home, which you've turned into an environmental health hazard. Now, after what I saw this morning, I figured that you wouldn't be bringing everything with you. So I've ordered a skip. It's coming at 4.
You so much as set foot in my home, I'll have you arrested for trespass.
You can't do that, because I'm the landlord.
And I'm the tenant. Who has rights?
I am sorry, but I haven't taken this decision lightly. The other tenants have been complaining about rats, and I can't afford to have the council on my back.
Your voice is beginning to grate. Furthermore, I'm sick. Dr. Bell won't let you evict me on medical grounds.
Oh, you can't be serious.
In fact, she's going to the newspapers.
You what?
I believe the article exposes corrupt landlords who throw innocent tenants out onto the streets.
I'm not corrupt.
If you back down now, we can all leave things just as they are, can't we?
It's more common than you think. I think it's 1 in 200 households in the UK have a hoarder.
She had stuff piled right up to the ceilings. I'm not kidding.
Really? Or is that you being slightly prone to exaggeration?
Dr. Bell, there's someone in reception to see you, and he is not a patient.
Dr. Bell?
Yeah, that's me.
I'm Jerry Sykes, Clarissa Cummings' landlord.
Right.
I'd like to know what gives you the right to attack my reputation.
Sorry, what?
You may not agree with my evicting Miss Cummings, but going to the papers before you've even heard my side of the story is well out of order.
I have no idea what you're talking about.
She told me that you're challenging my eviction on medical grounds.
No, I'm not.
Oh, I see. Well, it looks like I've been taken for a fool.
What's this about the papers?
According to her, you're being quoted in some article criticising landlords. In particular, me.
Well, that's not true.
I wouldn't put it past her to use your name anyway. She can be pretty resourceful.
Well, she can't do that. Who does she think she is?
Hi. How you doing?
So.
Really?
Just have to get on, don't you?
Well, I don't think anybody expects you to do that. You've just lost your soulmate.
Well, guess it wasn't my time to be happy.
I don't think it works like that.
I look around and everyone else seems to have what they want and I don't, and I blame Eva for letting that happen.
Well, that's understandable.
She had a choice. She could have not taken the assignment. She could have gone out sooner.
There's no way that Eva could have known what was going to happen.
Things could have been different if she'd just been sensible.
No, Jimmy, you can't think like that.
George, you don't understand, okay? She made a choice. It didn't include me.
Just all so doom and gloom. I daren't open my mouth in case I say the wrong thing.
Yeah, well, I reckon keeping it zipped is a good idea. Save us all from your droning.
Oh, watch it. I was going to suggest drinks after work, but I suppose that would be seen as insensitive.
Drinks? I reckon that's what we all need. I'll give Ruth a call, get her to come down. Heston, do you fancy drinks after work?
Oh, sorry, my dear, I'll have to leave on the dot. You'll have to try and enjoy yourselves without me.
Oh, well, we'll do our best.
Hi. Jimmy, thanks for coming in. There's 3 patients lined up to see you.
I'll let you know when I'm ready. Haven't you heard a knocking?
I did. Sorry, I just wanted to see if you were okay.
No, just give me a few minutes, will you?
Of course. I'll leave you in peace.
Don't know why you have to bother me twice in one day.
Your landlord came to see me.
So?
What's this about you going to the papers and using my name?
A tiny fib, nothing more.
You can't go around saying things like that.
He needed shutting up.
Right, well, it doesn't seem to have done any good because he's going ahead with the eviction anyways.
Why should that concern you?
Because, like it or not, I am your doctor and I have a duty of care towards you, especially if something's going to affect your health.
And what exactly do you suggest I do?
I don't know. Can't you stay with family?
I haven't got any family.
Right, okay,
Not anymore.
Was it an accident?
Nothing as clean-cut as that.
Shall I get you some water?
Perfectly capable of getting my own.
He's washing his hands over and over again.
It's just something that he does sometimes.
It's a bit weird, isn't it?
Well, Joe said something once, but Jimmy's a bit on the obsessive-compulsive side.
Oh, I see.
Yeah. And considering everything he's just been through, this reaction's pretty typical, don't you think?
I'm sorry, I shouldn't have jumped to conclusions about your family.
They may as well be dead. I've no one to blame but myself.
Why?
I wasn't always like this. I was like you, young, ambitious, my whole career ahead of me. But if you think you can have it all, my girl, you can't. You have to choose. I was a journalist in Fleet Street back in the 70s. I thought that would surprise you.
Well, that sounds like an amazing job.
It was most of the time. But with women being in the minority, I could never put a foot wrong, never show any weakness. I had to commit totally to the job, 110%. At the expense of my family.
Are you okay?
When I was 29, at the height of my career, my husband left, took my 2 children with him. They were 6 and 8. Oh. I don't blame him. It was no more than I deserved. The sad thing is I didn't even fight for them. I figured I could do what I wanted to do and get them back later. I was so arrogant. The glamour of the lifestyle seduced me. And I made my choice, selfish as it was. And for a couple of years, I admit, was the most amazing, incredible time of my life.
But then you wanted your family back?
By the time I realised that, they were teenagers and could barely remember me. Every present and letter I sent was returned. Over the last few years, I've collected little mementos to remind me of them. When I lost my job 7 years ago, that's when my collection became everything to me. It's all I focus on. Everything you see here is to do with them. The smell of those men's leather shoes reminds me of my husband. Lucy's favourite colour was red. She was fascinated by jewellery boxes. Jacob loved trains. These remind me so much of him. The newspapers mark the birthdays I've missed. The children were like magpies collecting leaves and pine cones. I used to paint them gold at Christmas. It's been over 30 years and they still refuse to see me.
You need your nebulizer. Where? Sit down. Sit down. Try to stay calm.
I know you said I should wait. I'm worried about you.
Well, there's no need.
Well, I think there is. Right, what you're doing with all the hand washing, I believe it's a reaction to anxiety, a bit like the mind going into overdrive.
Someone's been on the internet.
Sorry.
No, I'm fine. It's just something I get stuck doing sometimes.
It's only natural after what you've been through. But you're going to be all right. You'll come out the other end. I know you will. It's just that there's patients waiting, you see.
Yes, Ruth, I know.
I could call Vivian.
Was that a threat?
No, I didn't.
All right, just give me a few minutes, yeah?
Feeling better? When you look at all of these things, do they make you happy?
Ms. Cummings, please open the door. If you don't, I do have the authority to let myself in.
He can't.
We might not have any choice.
I can't lose my collection. I can't lose my family all over again. I need them. They're my life.
The skip is here and we need to make a start.
All right, wait here, okay?
Dr. Bell.
Yeah, hi, Jerry. Look, I know I said I wasn't going to get involved in this, but Miss Cummings, she's in a bit of a bad way.
I don't know what she's done to twist you around her little finger, but this eviction is going ahead. You've seen the state of that place. No one should have to live in a pigsty like that.
Yeah, no, I totally agree. To be honest, I think that all her stuff's doing her more harm than good, but we need to handle this responsibly, you know, to give her time to adjust to things.
I can't wait any longer. I've got tenants lined up for this place.
Well, she's at a very vulnerable stage right now, psychologically.
Vulnerable, huh? You got to be joking.
Trust me, if you force her to move out today before she's properly prepared, it could tip her over the edge.
Well, I've heard enough of this.
If you take them, you may as well rip my heart out too. We're connected. We have to stay together.
It's all right, Clarissa. Look, I'll deal with this. You go back inside. Go on.
She's seriously losing the plot, isn't she?
Being forced to move out today would be a huge shock to her system. It could seriously damage her health. You don't want that on your conscience, do you? I'm sure a caring, civic-minded man like yourself could find it in his heart to give her a little bit more time. He's agreed to give you 1 more week.
That's it.
He's got the law on his side.
Everything has its place. Everything belongs. I can't afford storage. And no landlord is going to let me bring it with me. What am I going to do?
I don't know. I just know that the skip's going to come back in 1 week and Jerry has the right to clear out this place completely.
Oh, no, that can't happen.
Look, I know that you're very attached to your collection, but maybe this is a good time to let it go.
I think I've had just about enough advice from you.
All right, look, you talk about this as if it's a celebration of family memories, but it's as if you're punishing yourself with it all instead.
I deserve to suffer for what I did. I destroyed my own family.
Don't you think that you've suffered enough?
You're making my head hurt.
Look, there are people that you can talk to, professional people. They can talk you through the guilt. They can help you forgive yourself.
That's not going to happen.
It's worth a try.
I don't need help. Yours or anybody else's.
Well, then maybe you would like a cup of tea.
Come back and see me next week.
Thank you. Bye, Miss Davies. Jimmy, I hope I didn't cross a line earlier. I just thought, you know, if I could help.
Fine, right.
Bye.
I know that change can seem scary, but
I just want things to stay exactly as they are.
Oh, all right then. Well, you stay depressed then. Your health will get worse. You just waste your life away. It's fine. Fine. Or you can stop blaming yourself and be free of all of this.
Don't you understand? Without this, there'd be no point to anything. There'd be nothing of me left.
Well, that's not true. You've still got loads of life ahead of you.
No, there's no future for me.
Well, no, there isn't. Not here, surrounded by all of this clutter. It's as if you've given up. You know, you used to be this high-flying, amazing career woman, and all you need is to regain some sense of pride in yourself. Wouldn't it be liberating to know that you can break the habit and just stop collecting everything? And what's so bad about moving to a new place? You can make a fresh start, make new friends.
I used to say I'd even deserve to.
I do. You just have to be willing to accept my help.
Maybe.
Oh, you can do this.
You know there won't be any happy endings for me, no tearful reunions with my family.
Perhaps not, but if you can just let go of the past, then maybe you can start to live some sort of normal life now.
You have a very positive view of the world, my girl.
Yeah, well, maybe enough for both of us. Give me a call at the surgery.
I suppose I should thank you.
Yeah. Why spoil the moment?
No, I think with Nick it was just might never matter. And he made such good progress because of his determination, he just refused to give up.
And just as he was getting somewhere as well. So not fair.
It's Jimmy I'm worried about.
How'd you get over losing someone like that?
Very slowly, I'd imagine.
I just wish there was something more we can do.
I know it's all very tragic, but there's a limit to how much I want to analyse and rehash it all.
I know what you mean.
The whole point of coming out for a drink was to lighten the mood, or try to at least.
I guess they just need to get it out of the systems.
Well, here's to my system getting full of beer.
Oh, what a day.
Tough one, was it?
Yeah, we're not being unrealistic in thinking that we can be career women and get married and have kids, are we?
Look, can we save the deeper meaning and full for another time and focus on the double vodkas and tonics, please?
Yeah, I can't stay long though. I've got to go home and pack. I'm off to Mum and Dad's to see JJ tomorrow.
You're not at work tomorrow? Well, that's another reason to drink up.
I'm not kidding. Dealing with all these students all day is making me feel so old.
Don't be ridiculous.
It's true. Look, these wrinkles around my eyes make me look so much older than I really am.
Oh, yeah? Maybe you need a bit of nip and tuck.
Oh, yeah.
Maybe some Botox.
And what about you?
Me? I don't need anything. I'm perfect.
Yeah, right.
Salami and sauerkraut.
Oh, no, thanks.
Time for some fun? Yep, for it.
In all my years in medicine, I have never experienced this sort of insubordination.
This is about last night.
I don't want this to come between us.
Ruth, will you please just tell me?
Dr. Sloan believes a dating agency holds the key to a series of deaths next in Diagnosis Murder. And later, Anne Robinson thinks today's weakest link contestants are a sorry bunch. What's new there? And that's at 5:15 on BBC1 Scotland.